Healthcare in America wasn't planned. It's patchwork. After the Revolutionary War, doctors earned the ability to charge their patients for any service they provided. This is very different than European countries or Latin American countries where doctors' fees were capped. This way of billing patients would be called fee-for-service and would become the foundation of American healthcare. Doctors fought tooth and nail to protect their ability to charge patients like this. As technology improved, healthcare moved from the home to the hospital. Hospitals have been nothing more than the dumping grounds for the poor. But after the Civil War, hospitals started to spring up in cities around America. As costs increased, hospitals catered to wealthier individuals, leaving the poor out in the cold. Politicians like Teddy Roosevelt pushed for universal health care since it became so expensive and inaccessible for so many. But doctors fought against this. Hospitals found themselves dealing with unpaid medical bills and empty hospital rooms. In 1929, an ex-school teacher and superintendent decided to offer the first health insurance plan to school teachers. It was a roaring success. The first healthcare plan helped patients and hospitals. Through the Great Depression and into World War II, more and more Americans started using health insurance as their way to finding healthcare. During World War II, to avoid inflation, the government incentivized businesses to give health insurance to workers instead of increased wages. Healthcare costs continued to rise. This left vulnerable populations like the elderly and the poor uncovered because they couldn't work to afford healthcare. In 1964, the federal government enacted Medicaid and Medicare to cover the health care of poor and elderly people. Congress, however, allowed doctors to continue fee-for-service, and so doctors billed more and more for their services to Medicare and Medicaid. The result was that costs skyrocketed. In the 70s and 80s, healthcare became America's biggest business. More than 10 cents of every dollar was spent on healthcare in America, and this would top out between 19 and 20 cents on every dollar in the 2000s. Large corporations that managed health insurance and hospitals grew larger and attempted to maximize their profits. A hospital and insurance company's profits started to influence medical decisions. The US government tried to give tax breaks to nonprofit hospitals so that they could care for the uncovered, but the need was too much, and nonprofit hospitals started to act like corporate players. With studies showing that many uninsured were being dumped on underfunded public hospitals, sometimes in the hour of greatest need, the federal government passed the Emergency Medical Treatment and Labor Act in 1986. This gave everybody in America the right to visit an emergency room for stabilizing treatment, even if they didn't have insurance. But as costs continued to rise, employers started cutting plans and the gaps widened. The Affordable Care Act attempted to close these gaps. The result has been mixed. What hasn't changed is that healthcare remains inaccessible and expensive for many.